Cigarette smoking kills more than 440,000 Americans each year, with an estimated 49,000 of these deaths from exposure to secondhand smoke, according to Center of Disease Control and Prevention website. Today I will be telling you about 3 different effects that smoking cigarettes lead to. I will be going over cardiovascular disease, lung disease, and cancer. I'm credible to talk about these topics because I researched them in 4 books. I will be summarizing the diseases you can get from smoking cigarettes. This speech will benefit you by giving information about what will be the effects of smoking. Now that I'm done with my introduction, I will move on to my first topic. The first topic I will be going over is smoking and cardiovascular disease. According to Health Consequences of Smoking in the United States, coronary heart disease, CHD, is the leading cause of death and is the largest contributor to excess deaths among smokers. Many prospective and retrospective epidemiological studies have identified cigarette smoking, elevated cholesterol, and high blood pressure as major risk factors for the development of coronary heart disease. Recently published epidemiological, autopsy, and experimental investigations have added to the understanding of the association between smoking and cardiovascular disease. Data from several epidemiological and experimental studies suggest that cigarette smoking is a major risk factor in the development of peripheral vascular disease. This may be part due to the decreased blood flow in arterioles and capillaries associated with cigarette smoking. Those who stop smoking cigarettes experience decreased risk of death from coronary heart disease compared to that of continuing smokers. This is a heart that is normal and a heart that is diseased. This leads to my next topic. The next topic I'm going to talk about is smoking and lung disease. Cigarette smoking also causes respiratory disease. The book Smoking and Health states mortality of certain respiratory diseases like bronchitis, chronic pulmonary fibrosis, chronic interstitial pneumonia, and emphysema increased and continues to show an upward trend. According to the Health Consequences, cancer and chronic lung disease states that in the workplace, in the large airways, cigarette smoke causes an increase in mucus gland size and goblet cell number. These changes result in increases mucus production and associated symptoms of chronic bronchitis. Large airway injury may contribute to airflow obstruction, but the peripheral airways are predominant in COLD, chronic obstructive lung disease. The regular use of filter cigarettes is related with less cough production compared with regular use of non-filter cigarettes. Cigarette smoking in combination with certain job exposures is relevant to high prevalence of respiratory symptoms and COPD, chronic obstructive bronchopulmonary disease, than is with cigarette smoking or occupational exposure alone. Recent research have confirmed that cigarette smoking exerts adverse effects on pulmonary clearance and macrophage function. Cigarette smokers have higher death rates from pulmonary emphysema and chronic bronchitis, and more frequently have impaired pulmonary function and symptoms of pulmonary diseases than non-smokers, according to the Health Consequences of Smoking. This is a picture of a normal lung versus a diseased lung. This leads to my last topic. The last topic I'm going to talk about is cancer and smoking. According to the Health Consequences of Smoking, cigarette smoking has been clearly identified as a major cause of lung cancer in the United States. For both men and women, the risk of developing lung cancer is directly related to exposure to cigarettes, which is the number of cigarette smokes per day, the total they smoked in their lifetime, the duration of the years they smoked, the age they started smoking, the depth of inhalation of the cigarette, and tar, nicotine levels in the cigarettes smoked. Smoking leads to many different types of cancers. Continued cigarette smoking by patients after successful surgical removal of cancer of the oral cavity, pharynx, or larynx without tumor reoccurrence for a period of 3 years is associated with an increased risk of developing the cancer for a second time. The book Smoking and Health identifies 8 sites of displaying higher risk of cancer among cigarette smokers. These sites are lungs, larynx, oral cavity, esophagus, urinary bladder, kidney, stomach, and prostate. I just explained to you 3 different effects smoking can cause. I told you about cardiovascular disease, lung disease, and different types of cancers. I summarized each topic and the disease that go along with it. I'm credible on these topics because I researched them in 4 books. So now that you know a little more about smoking, you can choose your future.